People living positively with HIV and AIDS not only face higher risk of severe illness from COVID-19 infection due to compromised immune systems, they experience challenges of accessing medication, particularly during periods of lockdown, although people who wanted to seek medical attention could be allowed to move after getting permission from relevant authorities. It was a different case for HIV and AIDS positive patients. This meant indirect forced disclosure of one's HIV status.
People living with HIV, first of all, their right to privacy was breached. Because when it comes to lockdown, very many people were forced to disclose, to go and get medical care from their facilities, because if I'm to remember very well, people are supposed to go through the LCs, present a letter that I'm positive. Then when you go on the road and you find police block, you have to explain to them and also show them that I'm sick. So it was really, really frustrating and traumatizing, because there are some people who are even still struggling to accept the fact that they're HIV positive, and they still have the self-stigma. So when you add self-stigma and then the disclosure, forceful disclosure, it was really so traumatizing and very unfortunate that even some people got more sick because some of them refused to go and disclose, and then they took their time not to take medication.
As a result, many people living positively either missed or got off life support treatment for some time.
During lockdown, it was so unfortunate that the week they announced a lockdown, I was supposed to get my medication the following week, and my drugs were done, and I was very scared. Where am I going to get medication from? There was no transport. I take my medication on Entebbe Road. I'm staying in Kisasi. I cannot walk there. So it was really a challenge. Those people called me, luckily enough, at the health center, and they told me, how can you access? Then I told them, you people, I cannot walk there. I cannot. Find a way. Then good enough, I thank God that those people tried to connect with some people who are nearer to meet, some clinics that are nearer. Then they transferred those drugs to them, and then those people also transferred them to me. But you see all that process. These people, the third party, they didn't know about my status. But now they also do what? They also know. And then when they bring on the village, people are so inquisitive. They want to know what have they bought for her.
Health facilities are not nearer where many people live. A health facility is a distance away from where people live. So it brought a lot of, stigma around the community, because some of us do not want to share our status to any other person. We want to live with it as we, and that is how we can manage it. So it brought a lot of issues around stigma. People stopped taking their treatment because they couldn't go to the RDC. Even to go to the RDC, you had to first go to the chairman. The chairman gives you a letter that is all disclosing.
So those clients who travel to the villages dropped off their drugs. They discontinued treatment. So on returning here, when the viral loads were done, we realized that there was their viral loads were high.
In this case, some patients had their viral load go up, thereby further compromising their immune systems.
I missed like for 3 days, yes, and it really affected me because this body, how it works, and the ARVs, that every time you have to take that medication. When you take that medication, it's that specific time they tell you. That is why they tell people take the medication at the right time. So whenever you take that medication at the right time, that is when the virus has woken up. If you don't take it at the right time, you find that the virus has gotten that space to wake up and produce. But every time you take it at the right time, it doesn't give it any chance to produce or multiply. So definitely my viral load increased because I did not take what? My medication, and also my immunity weakened.
Our visit to AIDS Information Center paints a picture to the challenges posed by COVID-19 pandemic to the HIV patients and service providers.
So therefore, when we realize that we are now increasing in clients who are not suppressing, it is not a good thing. as care providers. So therefore what I can tell you is that they are not down, but actually because of the high viral load, that automatically means that the immunity is getting low.
Although organizations and health facilities worked in collaboration with the Ministry of Health to ensure that HIV patients are served, others were missed out due to stigma and loss of connection.
So we tried to move around that to make sure that people actually access their treatment with ease. Number one, we have a number of peers. These are people living with HIV who are there to support their peers, called by either expert clients or linkage facilitators just as peers. So there were lots of home deliveries. So what had to be done was link up with the person in need. We had a toll-free helpline that people were calling. Others had their personal phones. So they would call and say, I'm here, I get my medication from this side, and therefore how can I be helped? So the peers helped a lot to deliver.
The COVID-19 pandemic has not only affected the treatment and care for HIV patients, but has accounted for the increase in new infections, especially for the young people.
Young people also are having 3 times higher new infections than the rest of the population. So out of the 38,000 new infections, you'll find that young people are about 14,000 new infections, and girls 15 to 24 are 3 times compared to their male counterparts. So they are bearing a higher brunt, and really because of the factors, because of the inequalities, the income, the poverty issues.
The most affected group is most definitely the females, because from all statistics, I've not seen a year or a month where there have been less new cases of females. They are always higher. If you have 20 cases in the month, I would say maybe 15 are females. The other 5 are males.
Uganda has an estimated 1.4 million people living positively with HIV. I'm Navka Farida and Adiana Kuti.